Today's live is all about skillfully using our clients' emotions for fast, effective, and most importantly, safe breakthroughs. So, welcome to this live, and we'll just get straight on it. Today, we're going to cover emotions, what to do when our client displays emotions to really help them to process their emotions effectively so that they can have the amazing results that they came to us with. So today I'm covering three things. So the first one is the things to avoid whenever we work with emotions. And second, what to do when they do come up. And the third and the most important part is how to ensure that our clients are safe within our sessions, especially when they are feeling very strong and intense, distressing emotions. So I'm going to begin this by asking you to rate yourself with regards to how comfortable and how confident you feel with regards to dealing with emotions whenever your clients whenever it happens within your sessions. So rate yourself. There's no right or wrong here. It's really just to gauge where you're at. So one being I am so scared of working with clients with who bring up emotions, and 10 I am super comfortable. I don't even know why I'm watching this video for it type of confidence. So again, no right or wrong, just see where you're at with this because we can always grow, right? We can always get better and we can always enhance our skill sets with regards to effectively dealing with emotions. So take a minute and really reflect on that because we're gonna get started about the things to avoid. And this is something that I used to do. This was mostly because this was how I was taught to do things. And really the one thing that we want to avoid is to avoid being like an FBI investigator when it comes to our clients' emotions. So I was traditionally trained in a method where we used age regression to regress our clients to a time and place in their past where they have experienced their symptom, right? And when a memory would come up, we were told to ask about emotions. And I was very much like FBI investigator with it. Like what I mean by this is like, okay, so there's a memory of you being bullied when you were 8. How did you feel? Okay, what else? Okay, what else? Okay, what else? Like I was that type of hypnotist, and now looking back now, it's funny, um, and we learn, right? So this is really one of the things that we want to try to avoid, and this could potentially come from just like me, where I was trained to do this. This was how I was trained, and looking back at that now, even just saying it out loud now, it sounds very ridiculous to have our sessions be that way, where a client is experiencing a distressing memory and we're like, okay, what else do you feel, what else do you feel, so that we have all of these emotions, but what do we do with it, right? Like it was kind of that thing where we just kind of like hoarded all of these emotions that our clients were gave us, but weren't really taught what to do with these emotions. So the next thing I'm going to cover is exactly that. So what do you do when something like that comes up within your sessions, when they're feeling something and you're hearing the same pattern or the same emotion coming up over and over and over again? So let's take the same example of, so say for example, your client, you are doing your age regression, or if you're using advanced conversational hypnosis, a client just spontaneously pops up with a memory of being bullied when they were younger. And they're talking about feelings. So they feel ashamed, maybe. And they're talking about feeling very ashamed. What do you do when that shame comes up? And really, inside our advanced conversational hypnosis sessions, we have a method called the emotional trance method that we talk about inside our trainings. But really, the principle of it is to just keep our clients' attention on that feeling or emotion. And in this particular case, the emotion of shame. And so we would ask the clients more question about that feeling of shame. So instead of hoarding all of the emotions, we can take it one at a time and really focus on that one emotion at a time because it's going to be more powerful once a client processes something like shame, right? So asking a client, okay, so you feel ashamed. Tell me more about that. And really just focusing their attention on it, and asking them about what their internal experience of it is. So what happens when they feel ashamed, right? What thoughts, feelings, or what is it that comes up um, in their mind, in their life, in their bodies? What images are they seeing? Whatever it is that they're feeling at that moment in time, we want to explore that and keep our clients' attention there. That is it. We do not need to do anything because by exploring and placing our clients' attention on that feeling, what they need to do or not do. Sometimes they don't need to do anything, they just need to let it pass. Sometimes, most of the time, when we just keep our clients' attention on that feeling and keep them by asking questions about their experience of it, that is more than enough to help them process the emotions. And our clients' minds are going to tell us exactly what needs to happen. Right. We don't need to force anything in ACH, we really take this approach of the client is pretty much the lead. We facilitate, but the client, what they say, what their response within our sessions, and how they answer our question really guides where the direction of our session. So it's completely client led. So this is going to be one of the best things that we can do when emotions do come up. Just have their attention on it, and I'm going to talk about safety afterwards. Make sure that their attention is on it, and by focusing our client's attention on that, we will know what to do. Our client's mind will tell us exactly what needs to happen next. We don't need to predict it. We don't need to have them erase the memory or something, or punch that bully. You don't need to do that. If the client says naturally, I want to punch this bully, then yes, go ahead, have fun with that. But it is not up to us to tell our client what to do with the memory, the emotion. So keeping it as simple as can be. And this is going to be the most liberating and most powerful thing that we can do for our clients. And so let's talk about safety now. Safety is super, super duper important. And we talk about this a lot inside our ACH trainings. We even have an ab reaction protocol to give the students exactly what to say, even though an ab reaction is completely rare. It's good to be aware of it and know what to do when that comes because it's for client safety and, of course, our own safety as well. And so, you also want to ask yourself this question because you know yourself best as the hypnotist and as the coach, right? If if you go into the session right now, how safe are you with managing really intense emotions with the client, right? And how can you personally ensure that your client is safe whenever they are with you? So answer this question, have it ready, just in case if you haven't yet. And if you have been to a training program before, look at what they say with regards to safety, and maybe you just need to brush up on that or change things up a little bit. But we have a very particular process that we teach inside our ACH trainings that really helps to ensure that we prevent reactions from happening. So, what is your training? What has your training program told you to do in terms of safety? So make sure you brush up on that. And also, this can be an intuitive process too. How can you ensure that your clients are safe when they process emotions with you? Some of us are very natural at being the person who other people just confide with, right? And you have that natural ability. So do you have that? And how can you utilize that? And how can you be more intentional with using that to ensure that your clients are safe whenever they have all of these intense emotions? And if you aren't confident yet, that's fine. That's a skill set to still gain and maintain and get better at, right? Again, there's no right or wrong here. It's just very important to know where you're at so you know what skills you get better at. And especially if you were someone like me who was trained in hypnotic regressions and taking people back to memories, not even just regressions, but something like timeline, even past life regression, this can bring up very intense emotions. So you definitely want to have a protocol that is unique to you and the clients that you have worked with, so that you can ensure that your clients are safe and not make it worse. Because unfortunately, I have heard horror stories of clients getting into a regression and them feeling worse afterwards. This is not to scare anybody. This is just to tell the truth about really prioritizing safety. And that's exactly why we teach this. And I even model this inside the ACH training. So when I take over the demo sessions, I will do the safety protocol first within the session so that my students can see it, and whoever the client is can really feel that as well. And so this is a great thing. Have a list of what you can do to ensure that your client is safe. It can be something as simple as telling them, right? Like if you don't know, just tell them you are safe with me. I am here for you. I will support you the whole way. I'm here to keep you safe. Something that simple is super, super powerful. So, I hope that all of this helped. The three things helped you to really get the juices flowing with regards to how to help your clients um, to skillfully use their emotions for fast breakthroughs. And I know we can talk about this all day, every day, but really the best way to see it is to see it in action because the unconscious mind is best caught, not taught. And so, if you want examples of exactly how this is done, then let me know in the comments below. Just comment the word emotions in the comments so that I can give you examples of this in action and examples of how we do it in ACH because I have tons of videos with regards to the demos that we have in conversational hypnosis that you can watch that clearly displays how to keep our clients safe during emotions. There's tons of that. I'm happy to send you it when you comment below the word emotions. And so I hope this helps. Just to summarize, main thing to avoid is stop being an investigator and hoarder of the emotions. Really just take it one at a time. And when an emotion does come up, make sure that your client's attention stays on that emotion by asking them questions with regards to the emotions. Like, tell me more about feeling embarrassed or feeling ashamed, and keeping them there and allow your clients to lead the session based on how their unique unconscious mind um, prefers or wants to process the emotion. Number three, how to keep your client safe. Make sure that you've brushed up on the protocol with regards to the trainings you have had, and make a list for yourself as to how you can best cultivate safety. You can even look internally from your old sessions that you've received and ask yourself, okay, what did I feel safe? How did I feel safe here? What could be better, and what can I do for my clients to ensure that they are safe? And again, if you want actual tangible examples on how to actually use emotions, then definitely comment below with the word emotions, and I will send you examples in video as to how to actually apply this because you're just going to get a much more better sense of the concept and you can grasp it better once you actually watch the demo. So definitely that is an option for you. If you have any questions at all with regards to emotions or how to have fast, effective, and lasting breakthroughs with your hypnosis and coaching clients, that definitely ask the questions as well. Ask me questions in the comments, or I'm also open for DMs because these questions will be featured over the next weekly live. So I hope this helped. Um, I will see you soon.